Hello everyone. Today we are going to discuss an important and urgent issue in Sri Lanka, the impact of a lack of nutrition rich food. While Sri Lanka has made strides in many areas, one of the most pressing challenges remains the country's growing problem of poor nutrition. This problem affects people of all ages, from children who suffer from malnutrition to adults who are increasingly at risk of non communicable diseases due to poor dietary habits. The lack of balanced nutrition has long term consequences not only on individuals' health but also on the overall well being of the nation. Poor nutrition leads to various health problems that are often overlooked, contributing to a range of chronic conditions. Today, we will dive deeply into the situation, highlighting the specific issues faced by the population and discussing why balanced nutrition is so essential for a healthy future. Malnutrition among children. Sri Lanka has made significant progress in reducing malnutrition over the past decades, but the battle is far from over. According to the Family Health Bureau's 2023 report, around 17% of children under the age of 5 are stunted due to chronic undernutrition. This means these children have not reached their full growth potential, affecting their physical and cognitive development. Additionally, 15% of children in this age group are underweight, a clear indication of insufficient access to essential nutrients. Here are some causes of malnutrition. Limited access to nutrient-rich food. One of the major factors contributing to malnutrition is the limited access to nutrient-rich foods, particularly in low-income families. Fresh fruits, vegetables, dairy products and proteins are often expensive and hard to obtain, especially in rural areas or for families living below the poverty line. Poor maternal nutrition. It is another significant cause of malnutrition during pregnancy. Malnutritious mothers are more likely to give birth to babies with low birth weights, which can have a long lasting impact on child's health and development. The high cost of food items like milk, meat, and fresh vegetables makes it difficult for many families to afford a balanced diet. As a result, they rely on cheaper, less nutritious foods such as rice, dal, and cheap processed snacks. Health consequences of malnutrition among children. Stunted growth and cognitive delays. The lack of essential nutrients, especially during the critical early years of life, can lead to stunted growth and cognitive delays. Children who experience poor nutrition in their formative years may face lifelong challenges in terms of learning, productivity, and overall well being. Weakened immunity. Malnutrition weakens the immune system, making children more susceptible to infections, illnesses, and diseases. This compromises their ability to thrive and can lead to chronic health problems. An example of this issue is seen in low-income families who rely on a diet primarily composed of rice and dal. While these foods provide some calories, they are often deficient in proteins, vitamins, and minerals which are necessary for a child's growth and development. Over time, this lack of variety and nutritional balance negatively impacts children's health, contributing to high rates of malnutrition across the country. Micronutrient deficiencies in Sri Lanka. In addition to the issues surrounding macronutrients, Sri Lanka also faces significant challenges related to micronutrient deficiencies. Micronutrients such as vitamins and minerals are critical for overall health, yet a large percentage of the population is not getting enough. Let's take a look at three of the most common deficiencies in Sri Lanka. Iron deficiency or anemia. Anemia is one of the most widespread micronutrient deficiencies in Sri Lanka, particularly among women. Nearly 32% of Sri Lankan women suffer from iron deficiency anemia due to inadequate iron intake. This leads to fatigue, weakness, and a higher risk of complications during pregnancy. According to the Ministry of Health 2023, iron deficiency is a serious public health concern in the country. Solution is one effective solution to combat iron deficiency is increasing the consumption of iron-rich foods such as leafy greens like mukunu and gotukola, fish, liver and legumes. Incorporating more of these foods into daily diets can significantly improve iron levels and combat anemia. Vitamin A deficiency. Vitamin A deficiency is another common issue in Sri Lanka, particularly affecting preschool children. Around 30% of young children in the country suffer from vitamin A deficiency, which can lead to vision problems, increased susceptibility to infections, and developmental delays. To address this deficiency, people should consume more vitamin A-rich foods, including carrots, pumpkins, mangoes, and eggs. These foods are affordable and readily available, making them a simple solution to improve children's health. Iodine deficiency. Although Sri Lanka has introduced iodized salt as a public health measure, iodine deficiency still persists, particularly in some rural areas. Iodine deficiency can lead to goiter, an enlargement of the thyroid gland, and other thyroid-related issues. The solution is to increase iodine intake through the consumption of more seafood such as fish and seaweed. These foods are natural sources of iodine and can help to prevent deficiencies. The rise of non-communicable diseases due to poor nutrition. While undernutrition remains a significant issue in Sri Lanka, there is another growing concern over nutrition. Poor dietary habits, especially in urban areas, are contributing to a rise in non-communicable diseases such as diabetes, heart diseases, and hypertension. Here are alarming factors. Diabetes. According to the Sri Lanka Diabetes Federation 2023, 1 in 5 Sri Lankan adults is living with diabetes. This is largely due to poor eating habits such as excessive consumption of processed foods, sugary drinks, and a lack of physical activity. Non-communicable diseases. Over 70% of deaths in Sri Lanka are attributed to non-communicable diseases according to the World Health Organization 2022. This stark statistic reflects the country's growing struggle with diseases related to poor diets and lifestyle choices. Main causes are high consumption of processed foods. The shift from traditional meals to fast foods and processed snacks is a major contributor to the rise in non-communicable diseases. These foods are high in unhealthy fats, sugars, and salt, which increase the rise of obesity, diabetes, and heart diseases. Low intake of fiber rich foods. Many people in Sri Lanka are not consuming